Why you shouldn't vote for Kamala Harris if the health of our children matters to you. When it comes to protecting the health and safety of our children, Kamala Harris has failed to act. If you care about the well-being of future generations, it's important to understand the devastating impact her administration has had on crucial health policies, specifically the lack of action on wireless radiation safety guidelines and the defunding of the world's most important cancer research. This isn't just a policy failure, it's a life-or-death issue that affects millions of American families. A vote for Harris is a vote for cancer, and here's why. Harris hasn't pressured the FCC to follow court orders. In 2021, a U.S. Court of Appeals ruled that the Federal Communications Commission, or FCC, failed to adequately protect the public from the non-thermal health risks of radio frequency radiation, known as RFR. The court made it clear that the FCC's outdated guidelines from 1996 are not sufficient to protect the health of children and other vulnerable populations. The court ordered the FCC to reevaluate and update these guidelines to reflect modern scientific understanding, particularly the evidence linking RFR to cancer and other serious health risks. Despite this clear legal mandate, Harris has done nothing to pressure the FCC to update these guidelines. 3 years later, the guidelines remain unchanged, leaving our children exposed to unsafe levels of radiation from cell phones, Wi-Fi, and other wireless devices. Why hasn't Harris taken action? The answer is simple: corporate interests. The wireless industry has a strong influence over policy decisions, and under Harris and Biden's administration, protecting industry profits has taken precedence over protecting public health. Harris's administration ended funding for critical cancer research. Perhaps even more alarming is the fact that Harris's administration abruptly ended funding for the National Toxicology Program, or NTP, which was conducting the world's most important cancer research on cell phone radiation. The NTP study found clear evidence that radio frequency radiation causes cancer. This research was groundbreaking, confirming the risks that wireless radiation poses to human health, particularly in children. Yet, after these critical findings, Harris and Biden shut down funding for the NTP. Why? Again, it's about protecting the wireless industry. This decision to halt research wasn't made in the interest of public safety. It was made to silence the growing body of evidence that cell phone radiation is dangerous. By ending this research, Harris's administration has effectively put millions of Americans at risk, especially children who are more vulnerable to the harmful effects of RFR. If Harris truly cared about public health, why would she stop the world's leading cancer research on this issue? The health of our children is at stake. Children are particularly susceptible to the harmful effects of wireless radiation because their developing brains and bodies are more vulnerable. Studies have shown that radiation penetrates deeper into children's brains than into adults, and long-term exposure could lead to serious health issues, including cancer. By failing to update safety guidelines and defunding critical research, Harris has put the health of our children in jeopardy. She's ignored the science, ignored the courts, and allowed corporate interests to come before the safety of the public. A vote for Harris is a vote for cancer. Let's be blunt. A vote for Kamala Harris is a vote for cancer. Her administration's refusal to act on the dangers of wireless radiation and her decision to end vital cancer research is nothing short of reckless. The science is clear. RFR poses a serious health risk, and the outdated safety standards are leaving us exposed. If you care about the health of your children, you cannot support a candidate who has actively ignored this issue for political gain. We need leaders who will stand up to corporate interests, hold the FCC accountable, and restore funding for the research that will help protect future generations. Final thoughts: demand action, vote for change. The time for inaction is over. Harris and Biden have failed us, and if we want to protect our children, we need to vote for leaders who will prioritize public health. The only way to ensure that the FDA and FCC act in the interest of the American people and not corporate profits is by electing officials who are willing to fight for us. Your vote can save lives. Don't let Harris's inaction on this critical issue go unnoticed. It's time to demand answers and hold our leaders accountable for the health and safety of our children. Vote for change, not for cancer. Learn more. Visit RF Safe for more information on the dangers of wireless radiation and how we can protect our children's future.